Have you been told that hormone testing is inaccurate or unhelpful for your symptoms? Or maybe you've done hormone blood tests, but they've all come back normal, even though you continue to struggle with problems like poor sleep, low energy, moodiness and irritability, depression or anxiety, pain or cramping, irregular or heavy cycles, weight gain, or even hair loss. The Dutch test is the answer. Keep watching as I explain the key elements of the Dutch Complete Report that you need to be looking at in order to understand your results and put that data to work. One of the best parts of my job is helping people achieve their aha moment, the instant where everything they've been struggling with finally makes sense. And because they understand the root cause of the issue, they now have a clear path forward. This is especially meaningful if that person has been told everything is normal on their lab testing for years, even when they can tell that something isn't right. That's why I love advanced functional testing, particularly the dried urine test for comprehensive hormones, aka the Dutch test. Because having accurate, precise, and clear data to guide your next step not only increases the likelihood of your success, but it also gives you confidence in your strategies. But I'm getting ahead of myself a little bit. In this video, I'm going to explain the key aspects of the Dutch Complete Report that you need to pay attention to in order to understand your results. While there are several versions of the Dutch test, my go-to is the Dutch Complete. So when I say Dutch test in this video, that's what I'm referring to. Even if you haven't done the Dutch test yet, you'll still want to tune in because I'm also going to explain why I think that every woman should get one and why it's better than other hormone testing. If you need help getting your hands on a Dutch test kit, be sure to check the link in the video description to get yours ordered. We help folks all over the world get access to this testing, and I'll even help you interpret your specific results. So be sure to check that out when we're done. Just one more thing. If you do happen to have a Dutch test report, it would be a good idea to track it down so that you can follow along a little later in the video. All right, let's start with the top 5 hormonal symptoms or conditions that the Dutch helps investigate. Number 1 is perimenopausal symptoms like brain fog, sleep issues, weight gain, period problems, and others. The reason this is at the top of the list is because so many women are told that hormone testing during this tumultuous time isn't helpful or accurate. And in some ways, this is true, particularly if you're only offered blood testing. But comprehensive urine testing, collected at the right time, not only gives you accurate insights into your hormonal shifts, but it helps you initiate appropriate treatment strategies far sooner, decreasing your misery and increasing your longevity. More on this in a minute. Number 2 is menopausal symptoms and menopausal hormone therapy monitoring. You probably know that MHT is a very popular and controversial topic right now, and many women who previously didn't have access to supplemental hormones are now using them. The Dutch helps track these treatments and ensure that your body is handling the additional hormones safely. Number 3 is fertility. If you've been told that your hormones are normal, but you're still struggling to get pregnant, I cannot recommend the Dutch strongly enough. Number 4 is PCOS. Again, especially if your blood tests reveal normal hormone levels, the Dutch has the advantage of testing active hormone metabolites, as well as hormones themselves. And it takes into account adrenal hormones that play a huge role in symptoms like weight gain, metabolic syndrome, acne, and other signs of androgen dominance. Number 5 is endometriosis. Getting an endo diagnosis is difficult enough. Evaluating treatment options can be a nightmare. The Dutch can help you figure out if you're making too many proliferative estrogen metabolites, which are associated with an increased risk of endometriosis and can worsen symptoms and progression. If you do find that your body is making more than your share of these metabolites, you can utilize targeted strategies to decrease them and even measure your progress with the Dutch. Other issues that the Dutch can help clarify and treat include PMS, irregular or absent periods, low libido, mood swings, breast cancer, burnout, sleep disorders, and even hair loss and thinning. So what is the Dutch Complete test? It's an at-home, dried urine test that measures 24 hormones and hormone metabolites, including 3 different estrogens, testosterone, DHEA, cortisol, progesterone, and more. Plus, another dozen markers for nutritional status, gut health, and neurologic health. There are several versions of the Dutch test, including the Dutch Adrenal Panel, Dutch Plus, Dutch Cycle Mapping, and of course, the Dutch Complete, my personal favorite. How is it different from conventional hormone testing? First of all, it's much more comprehensive than standard hormone testing, blood or saliva included. That's because it measures and maps out the ingredients needed to make your hormones, the hormones themselves, and most importantly, your hormone breakdown products or metabolites, which are often very active and potentially disruptive. Second, it's super convenient and non-invasive. No need to travel to a lab for a painful poke or collect gross specimens. All you need to do is urinate on a paper test strip a few times, let them dry, and then send them off in the mail. Third, the Dutch gives you more specific, narrow normal ranges, including pre- versus post-menopausal ranges and age-specific ranges. If you're premenopausal, you'll collect your sample at a specific point in your cycle, about 5 days after ovulation, so that you know exactly where your hormone levels are supposed to be instead of relying on a normal range big enough to drive a bus through. And you'll measure adrenal hormones multiple times per day for insights into circadian rhythm and stress resilience. This goes way above and beyond a random blood test. Fourth, the Dutch test is available when and where you need it. We send test kits all over the world. For example, we've shipped the Dutch test to Jamaica, Kuwait, Canada, Mexico. The list is growing all the time. Again, check the link in the video description for info about ordering your Dutch test, and I'll even help you interpret it. If you already happen to have a Dutch test report, it's time to pull it up and get your pencils ready, because I'm going to share the most important, crucial elements of this report that you need to look at in order to understand your results. I've interpreted hundreds of these reports in my career, and I keep coming back to these key aspects, and now you can too. The first thing you need to know in order to understand your results is how to read the dials, not only so you can see where your hormone levels fall compared to normal for the individual hormone, but more importantly, how they compare to the other hormones on this report. By giving us these dials, the makers of the Dutch have done us a huge favor, because now you don't have to do a bunch of math in order to see which hormones are more dominant or to spot imbalances. Let's look at a quick example, and just as a FYI, the Dutch recently changed the look of their report, so you'll see examples in this video from both the new and the old version. All right, here you can see that both progesterone and estradiol are within the normal range. But look at how high estradiol is compared to progesterone. You better believe that this can cause symptoms of estrogen dominance, like heavy periods, bloating, fatigue, and weight gain, even though they're both technically within the normal range. Speaking of normal ranges, another thing you'll notice about these dials is that the ranges are different based on age and hormonal life phase. The green range represents the optimal range for females before menopause, and the purple is postmenopause. This helps you get an idea for what's appropriate given your life phase. For example, you can see that this person's testosterone is in the purple, postmenopausal range, but they're in the premenopausal range for progesterone, and they're above the green range for estradiol. I find these separate ranges are the most helpful when looking at estrogens because there's a gap between pre- and postmenopausal ranges. That's where you may find yourself if you're in perimenopause. This is particularly useful because the normal ranges for estrogens in pre- and postmenopause for blood labs actually overlap, making it difficult to know when support is indicated and where you are in the perimenopause to menopause transition. Yes, it is true that estrogens can fluctuate erratically during perimenopause, but the Dutch can at least tell you if you're dipping into a range that's lower than ideal, because it may trigger symptoms like hot flashes, fatigue, brain fog, muscle loss, hair loss, and weight gain. Now that we've examined the individual data points, the next step is looking for patterns in the big picture of your hormones. Page 3 of the Dutch Complete is my favorite page for this because you can see androgens, estrogens, and progesterone all in one spot. Now, I understand that all of these arrows and lines and numbers can get confusing, so I like to think of this page as a flowchart or a cascade that goes from the top of the page to the bottom. At the top, you have the ingredients for your hormones, things like pregnenolone and DHEA. Then, if you follow the arrows, you'll see the hormones themselves, like progesterone and testosterone. And then, if you keep following the arrows, you'll see the hormone metabolites that represent how your body is breaking down or detoxing your hormones down different pathways. So, let's trace the flow of androgens for practice. You'll see that pregnenolone can be used to make DHEA, which in turn can be used to make androstenedione, which then can be used to make testosterone. Testosterone can be broken down into 5-alpha or 5-beta DHT, one of which can cause hair loss and thinning in both men and women, as well as prostate inflammation in men. Hint, it's 5-alpha DHT. You'll also notice that testosterone can be converted to estradiol via an enzyme called aromatase. This may sound familiar if you have a history of hormone-positive breast cancer, because several medications block this aromatase enzyme in order to stop the production of estradiol. For this and several other reasons, the Dutch test is super helpful for those who are interested in preventing recurrence of breast cancer. Following the arrows is a great way to understand your hormonal big picture, but it can also be helpful to look at the broader categories of hormones: androgens, estrogens, and progesterone. Is one of these groups more dominant than the other? That can help you determine which hormones need more support versus detoxification encouragement. Perhaps all of your hormones are low or on the low end of normal. That can indicate malnutrition, a slow metabolism, general frailty, even chronic stress and burnout. Speaking of burnout, one of the reasons the Dutch Complete is my go-to version of Dutch testing is because of page 5 of the report, the HPA axis section. If you've been hanging out on this channel for a bit, you'll know that I'm super focused on the stress response system and its impact on overall health and longevity. My YouTube library has tons of videos exploring cortisol levels, and the beauty of this test is that we get to see cortisol a couple of ways. First, you'll see metabolized cortisol. It's the most accurate measure of total cortisol production overall. But you'll also see free cortisol and cortisone, as well as the cortisol curve representing how your free cortisol and cortisone levels fluctuate throughout the day. I like to think of cortisone as hidden cortisol because cortisol and cortisone trade places back and forth. It's important to measure both so that you don't miss elevations or insufficiencies in one or the other. You'll also notice that the Dutch test now includes a cortisol clearance rate. And this is a new data point that they recently added, which is super helpful, because if your cortisol clearance rate is low, it can sometimes point to poor thyroid function, which is something that very often contributes to broader hormonal symptoms, especially weight gain, bloating, fatigue, and hair loss. This page is why I insist upon Dutch testing, even when people tell me they had a normal cortisol blood test. It's just not telling the whole story. And the HPA axis plays such a huge role in reproductive hormone health that it can't be ignored. If you are still feeling confused or overwhelmed by your Dutch test results, I totally get it. There is amazing and actionable data here, but it's also a lot. And even when you understand what the test is telling you, it isn't necessarily easy to know what to do with that information. The good news is that I can help in a couple of ways, actually. First, I made a step-by-step, line-by-line walkthrough of the Dutch Complete that lives in the YouTube member library. I also included some of my suggested strategies for different patterns seen on the Dutch Complete, for example, high cortisol versus low cortisol, estrogen dominance versus estrogen insufficiency, etc. Members also have access to my Hormone Balance Deep Dive, a 2-part tutorial that covers the top 5 causes of hormone imbalance and how to correct them. You'll get instant access for just $7.99 when you join the membership. To sign up, log into your YouTube account and tap the Join button on my YouTube homepage. If you're tired of DIYing and you would like me to review the Dutch test that you ordered elsewhere and suggest some next steps, you're welcome to apply for a functional case review. You'll be able to submit your Dutch report, a detailed history of your symptoms and concerns, and any other recent testing that you'd like me to review. It's a pretty convenient way to get my eyes on your specific labs and get personalized recommendations. Of course, if you still need to get your Dutch test, we ship them all over the world, and I'll even send you a video interpretation of your results when they come in. Check out the link in the video description for more information and to get your order started. Thanks so much for watching this video. I hope you found the information and insights helpful. If you did, I'd really appreciate it if you'd take a second to like this video and subscribe to my channel. Your support, encouraging comments, membership, and even freebie signups really do mean the world to me. And they enable others to access the functional medicine resources and information that they need. Thanks again, and we'll see you in the next one.